So the key challenge for a lot of Asian women, and again, before I talk about Asian, and Asian is already very diverse population, over 34 ethnic groups identified within Asian. So in this research, we had covered Chinese and Japanese and Indian and Korean and one refugee background as well. So we couldn't, cover everyone, but it's like a majority of the representative here. So the key cultural challenge is relevant to Asian women's traditional role as a homemaker and mothers. Hence, compare with women from a more individualist cultural background, Asian women tend to feel like huge responsibilities during that period of time. Everything go wrong with the baby, and that maybe the mother has to put the baby first in front of her own needs. So that's a kind of a lot of unseen kind of a expectation already there. And Asian women's cultural background kind of leads that challenge within the family. And even though some of the mothers expecting a lot of extra support, like, our Pacifics, Jacinda was saying, like in that time is a special time. And as a migrant woman, there's a lot of support normally they could access in their back country are not probably going to have it. Well, we even in the last 3 years we had a COVID. Normally some extended family would come to support with extra hands and providing a special food dietary requirement after giving birth, but all those are become really challenging as a migrant new mom. So that's have been putting a lot of challenge literally along of some within the culture challenge as well. So that has been adding some extra pressure. We know that's again, yeah, the lack of understanding of maternal mental health and mental health is really huge stigma attached with you don't want to be labeled as mental illness or depression or any of the name. So that's why we found the help-seeking behavior are really low. Like people don't want to admit they're mad, like they got mental health issues as such to give that heads. So, and also lack of understanding of mental health system in general is another barrier for accessing services as well. And another thing we identify big, apart from stigma and mental health issues, is a discrimination, language barrier, not knowing certain things are in place to support them, even psychological interventions are available and certain services available. So they really have a poor understanding around those support system in the society and health sector as well. So that's quite a significant just the factors. But again, to have a lack of awareness of New Zealand's service, but also the Western model that when they receive the service, even there's quite a bit of conflicts of even how you co-sleep or how feed breastfeeding your baby. There's a lot of things that are quite conflict with the New Zealand Western model. So they tend to kind of not be quite trusted the system to speak out to what they actually practice within the culture to keep that bonding of mom and baby relationship. So that's another barrier we found is quite a significant within some of the new mothers as well. And systematic barrier of not really having interpreters in place. A lot of women can speak English, but again, when it comes to the health and kind of terminologies, it quite challenging for them to understand the whole picture, probably partially, but they are probably too shy to ask, because then they will be again putting shame on themselves and felt discriminated as well. So again, that's another challenge. So there's a more systematic challenge as well, because the hospital, how it runs, and even the food and challenging with the aircon on, because a lot of even given myself as a Chinese, the aircon is quite cold and you don't want to have that blow on your head when you're just giving birth, you don't have a cold showers. So some of the really practical stuff is not really aligned with some of the culture as well. So there's quite a number of things that are challenging for Asian women.